We're at the Mercy Corps World Headquarters in downtown Portland. About 200 people work here. The vast majority of the Mercy Corps workers live and work in the communities in which they serve. So glad you're with us on Comcast Newsmakers. I'm Ken Ackerman. The U.S. spends more in healthcare than any other country, yet we live shorter lives. In fact, we rank 28th. Why is that? Well, please welcome Lillian Shirley, Director of Multnomah County Health Department, who could shed some light on this. Thanks for being here with us.
Thank you, Ken.
We rank 28th. So what is broken? And I know we only have 5 minutes. What is broken about our healthcare system?
Well, the problem, our system is aimed really at treating illness and not at keeping Americans healthier. So the way we like to describe it in public health, sometimes the story we tell is if you think about people falling off a cliff, our response, we do respond as Americans, but we send an ambulance to the bottom of the cliff. And what we need to start thinking about, I think, in healthcare is, well, what about building a fence at the top of that cliff so people don't fall off? And that's what public health people do. We build the fence, we put up signs to tell you to be careful, and we also show you a road that you can take to be a safer way to get to the bottom of the cliff.
So as a country, you say we're less preventive and more reactive, and that ultimately needs to turn around.
That's right, that's right. This is not just a problem for individuals seeking health care, it's a budget problem. It's killing family budgets, it's killing state and local budgets, and as we definitely know, it's also killing our federal budget right now.
Now, as far as birth rate in this country, that again is an alarming statistic. Tell us about that.
Right. Well, the United States is 32nd in infant mortality, and around the world, the rate of babies dying, infant mortality in their first year of life, is one of the key indicators about how healthy a mom is, how healthy a community is, and it's about the future, our future. Our children are our future, and we know that. So we look at those indicators to say, what is it that we're doing that can really help our children getting better? More and more technology in the operating rooms and the birth centers are really not what's going to help us with this. It's more nutrition for moms, better thinking about when you want to get pregnant, prenatal vitamins, things like that that help people really have a better outcome for their children when they get born. And then we want to keep them safe. We want to immunize them. We want to make sure they don't have childhood diseases.
Now, you know, when we talk about public health, well, a lot of people think about polio has been eradicated, smallpox. Have we really hit the ceiling as to what public health can do?
Well, I think not, and you know, I remember being a little girl and not being able to go back to school in September because of polio outbreaks, and there's very few people, young people today, who even can remember those days. But I think we have an opportunity. I think the 21st century equivalent of those kinds of strides that we've made in communicable diseases is preventing chronic diseases. Right now, we spend, as a country, $2.6 trillion every year on chronic diseases. And if anybody watched any of the news stories last night, they know that every major network and cable news show led with a story about the impact of obesity and diabetes in our children and what's happening there. And this is a problem not just for the future of our country's budget, it's a problem for our workforce in the future.
Is it just education, nutrition education, to curb an obesity problem, or does it go deeper than that?
I think it goes deeper than that, and I think that first of all, we have to come together. You know, I'm a mom and a grandmom, you know, and I think that as I look at some of the things that were available to me as a kid and my sons and daughter as they were coming up, I think we have to look at things like, are we having choices in our schools? Is the only thing we're offering are sugar-sweetened beverages? Do we have water fountains available? Do we have park spaces available? Do we have recreation? Do people feel that it's safe that their kids can walk to school, take their bikes to school? You know, those are the kinds of things that all together as a community we can make sure.
All right. Lillian Shirley, thank you very much. Some informative stuff, and we appreciate you joining us on Comcast Newsmakers. We want to thank you for being here as well. For the crew, I'm Ken Ackerman. Make it a great day.